This is Dr. Matt McGee, and I am a dentist here in Nashville, Tennessee. And I'd like to talk for a few minutes here about dental amalgams and why they need to be replaced from time to time, and materials and ways that we replace them. First of all, just a little history about dental amalgam. It's been around for hundreds and hundreds of years. It was the first documented use of amalgam was back in China in 658, and later on it made its way into Europe in the 1500s. By the 1800s, though, dental amalgam had become the main filling material used to treat cavities. And that's usually because of its cheap cost, its ease of placement, and durability. Now, amalgam is simply a word that just means a mix of different metals. And as you can see here, amalgam is made up of silver, tin, copper, trace metals, but also mercury. There's been a concern about mercury toxicity, and that's a discussion for another day, but suffice it to say that the American Dental Association has said that mercury content of amalgam is not dangerous. Okay, so let's look at a couple of teeth in the mouth. Here is a filling in a tooth made of dental amalgam, and it's got some problems with it. There's some gaps around the edges. There's some little fractures in the enamel. And the problem with that is once you get cracks and fractures and gaps around a filling, it's really not sealing the tooth the way that it properly should, and you can get moisture to leak up underneath there. Bacteria, saliva, food particles, anything that's in your mouth can leak up underneath these fillings. It's kind of like if you have a crack in the foundation of your basement and you're getting water in your basement. Well, in this case, you're getting water or leakage into the basement of the tooth, and as you can see here, after we remove the amalgam, there's decay up underneath that filling. And just like water can damage the inside of your house, anything that leaks up under an amalgam can damage the inside of the tooth. Now, this patient was advised to go ahead and replace the filling, even though she didn't have any symptoms at all. A lot of people say, well, hey, this tooth isn't bothering me. Why does it need treatment? Well, as you can see in this picture, this can sometimes be the case. This is why. If the amalgam is not sealing the tooth the way that it should, stuff leaks up underneath there, and then you've got a problem with decay, and the tooth is weakening from the inside out, even though it may not be hurting you or giving you any sensitivity or symptoms at all. Again, here's a little before and after. Top picture has the filling in place, and the bottom picture has the filling just after it has been removed, but prior to removal of the decay and filling the tooth with a new material. Here's another example. See a little bit of darkness around the upper edge of that filling, and when we took it out, lots of decay up underneath that. Again, this tooth was asymptomatic. There was no pain, there was no sensitivity, but that decay was up underneath that filling doing some damage. Now, of course, every situation is different, so you should always check with your dentist to see if your fillings are needing to be replaced or if they're okay. So what do we replace them with? Well, in my practice, we like to place a tooth-colored filling material. Here's a silver amalgam that needed to be replaced, a little decay on the side of the tooth. And when we replaced it, we used a tooth-colored filling material called composite resin. That's often also referred to as bonding, but it's tooth-colored, and as you can see here, after we place the new filling, it's very pretty. It's much more natural and more aesthetic looking, but also there's no metal, and of course there's no mercury. Here's another example. Here's 3 teeth that had some amalgams. They all had some problems, weren't sealing the teeth properly. And here they are with composite resin in place. That was done in one visit. And again, no symptoms from the patient, but there was decay up underneath these fillings. Here's one more example. In this case, we use a porcelain onlay to restore the tooth, which is similar to composite resin in that it's tooth colored, but it's a little bit stronger, a little more long-lasting material to restore teeth. Anyway, hope you've enjoyed this. Again, I work in Nashville, Tennessee. This is a picture of me and my staff. If you have any questions about dental amalgam or your fillings, please feel free to contact us. You can find more information about our office online at our office website at mynashvillefamilydentist.com. So check us out, and thank you very much for listening. I hope you found this informative and useful.